All right, good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the face, and the voice of Dr. AdeLola Ashaye, CEO, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because the quality of life is just as important as the quantity of life. We're here again doing another Facebook Live on the question, Doc, how can I trick myself into eating healthier? Please and thanks. And I have the one and only awesome Dr. Lola Ashaye, who is here with us live. Hi, Doc. How are you?
I'm good. Thank you for having me.
My pleasure, my pleasure. Now, for those of you who are watching live, hashtag live. Those of you who are watching or will watch and replay, hashtag replay. And of course, to share. All right, Doc, please kindly introduce yourself. Who are you and what do you do?
Awesome. Thank you. Hello everyone. My name is Lola Ashaye. I'm a family doctor, which means I take care of primary care needs of people like annual exams, women exams, chronic care conditions like diabetes, high blood pressure, high cholesterol, and acute care conditions like colds, UTIs, all that stuff. I've been practicing medicine for over 10 years now. My passion is preventing serious health conditions with a focus on lifestyle methods. And I'm able to do that more easily in my membership or subscription based practice called InTouch Primary Care in Sugar Land, Texas, which is a suburb of Houston.
Yay, Texas. Woohoo. Let's give that shout out. Awesome, awesome. I love the emphasis on helping people live better through lifestyle changes. Now, inquiring minds want to know, why do you do what you do? What was it that sold you on what you are doing right now?
Yeah, I think I had my training was a big part of it. So I trained and stayed at my residency program for 4 years following, and I did inpatient and outpatient care. And so I got that opportunity, right, to see how patients, the patterns, when you took care of patients outpatient,
Mhm.
how they did, inpatient, because it was the same set of patients. And I think there was a had advanced diabetes, and she had neuropathy, damage. She had eye damage. She had heart disease. She was walking with a cane. She was always in pain. And when I got the opportunity to look back at her chart, because she'd been a residency clinic patient for
Right.
years, and it just was amazing to me how simple it started out. How,
Mm.
just pre-diabetes that wasn't
Right.
treated,
Right.
and lapses in treatment and things like that. And then to see how much she was suffering and how much her family was suffering just because simple things were not done. And I think it really struck me like things can be prevented. Like, people need to really, I just wanted to make it clear that there are things you can do if you do them early on. It makes a huge difference. And some of those things are not that difficult. I mean, it takes time and some hand holding, but it's very possible. And so now my goal is just, really do my own part in helping
Mm.
people understand the importance of investing in their health now, taking good care of themselves now, and not delaying their care because the consequences are huge.
And sometimes, dog, and you can agree with me, sometimes it's hard to sell it on to people like it's important, the preventive part, because you don't want to wait till you get the sequelae, you get the admission in the hospital, you get the, God forbid, the heart attack. Before then you try to reverse technology it. Things can be prevented. The same way we don't wait for our fancy cars to break down, we go for check-ins. We are of much more value, and it's important that we prioritize our health. Thank you for that emphasis. Now, Doc, I have someone who's listening. It's like, yeah, yeah, yeah. I got to eat healthy. But what is your general approach to helping patients eat healthy? Like, what would you say for someone who's coming to see you? Is like, should I be afraid? I feel like I'm going to be getting nagged at, or I'm going to get yelled at for what? But what is your general approach to helping patients generally eat healthier?
Well, I think first is really trying to address their mindset. So, because the truth of the matter is, food is more than just food. It's cultural, it's emotional, it's relationship. And people really, they love food. They love food for different reasons, and just telling somebody to change a habit all of a sudden is not realistic. It's not going to happen.
Mhm.
So my approach is really trying to help them find meaning, find their why as to what is worth it for them to change. What pain are they going to address, or what potential gain can be a motivating factor for them. So, because as much as you want somebody to do something, if they don't want to do it, it's, you're just talking. So I'm always just trying to move them a little, one step closer
Right.
to that, because it's a partnership. So example, I had a patient who had constipation, and we talked about her diet, and she was just kind of like, I can do better, but all that stuff. And then she mentioned that in the past she used to avoid dairy because she had abdominal issues. And then
Mm.
she said, oh, but I love cheese. I eat cheese all the time now. I just love it. And she kept saying that. And I said, well, why don't you just hold the cheese for 1 month? Let's see what happens. Just try. And she lamented and everything. I said, you don't have to do it, but an experiment. Let's try it. And within a few days, I checked in with her. I'm like, how are we doing? She said, oh, the constipation is completely gone. I feel great, da da da. And I was like, okay, well, I didn't have to talk too much after that because now she had seen for herself that, now she knows, right? So she understands the relationship. So sometimes it's just when her pain has been resolved, she's
Mm.
found a reason to do it. And
Mm.
now it seems a little bit more worth it for her. So that's what I try to focus on. I just try and focus on what is it about that is going to help this patient change their mind about eating healthy or
And
healthier.
and the truth is, and we know this over and over again, that our patients feel better when they make these changes. It's not just about making the labs look pretty or making our charts look good. Like, hey, your numbers are good. You actually feel better, more energy, better sleep, better bowel movements, easier bowel movements, even with some of these changes. So it's worth it in the long run. All right, my next question for you. So I can relate with those who are probably wondering, Doc, I'm a foodie. Like, come on, like food, like you don't understand. Work life is stressful, and by the time I come home, I got to give myself a pat in the back, and usually I get to indulge in the foods that I like. So when you tell me that I should avoid this food or limit this food, you're messing with my chill time. Yeah. So what would you say to that?
Yeah, so I mean, I get it. Like I said, food is more than just food. I get it, right? But I think what I would say is, think big picture as much as possible. Just try and think about what all your values together. Like, okay, what do you truly value about your life, and what would you like it to be long term? And then you want to use that to guide your choices now. So I wouldn't say you have to do everything all at once, first of all, like, because when you feel like you're limited, that doesn't help. I am more of the approach, take baby steps over time. Just try to incorporate as many healthy things as you possibly can, and look for substitutes for things that are maybe healthier substitutes as much as you can. Don't just say, oh, I've always had ice cream, I'm never going to try frozen yogurt, or you know or even a smoothie. Like, you may be surprised, you might like it better than you think. So you can just try to find alternatives and see how you do with that, because it's worth it.
All right, you mentioned baby steps, Doc. So for someone who's watching, all right, Doc, I got my pen, I got my paper. Give me 4 steps. What are baby steps? Like, what are tricks or hacks I can use to eat healthier? Something I can implement right away. What would you say?
Right. So I always think about adding instead of limiting. So, for example, I would say for me, I try to eat a salad for lunch every most weekdays. So I pick, I'll say pick a meal that is not as, you don't really maybe it's not your best meal. Maybe like for me, lunch, it's lunch. I just want to is I eat it because I'm just putting something in my body at the time, right? So it's not
Right.
as important for me to sit there and thoroughly enjoy it.
Mm.
So what I do is, okay, I'm going to eat a salad, and what I do is I pack as many healthy things in it as possible. So I put all the nuts, the berries, chia seeds, all that stuff, because I'm trying to build up my good bacteria in my gut. So that's how I think about it. So you can pick a meal, try to add as much healthy components into that meal as possible. It could be a smoothie, and try and do it as often as possible. So that's one thing that can be helpful. The other thing that another thing might be drinking water prior to eating. So when you drink about 2 cups of water prior to eating, it actually fills you up to some extent so that you don't eat quite as much. So that's another thing that can be helpful that you can start to do right now. Another thing I'll recommend is try and chew a little slower. So sometimes, and I have to talk to myself about that one too, because,
I chewed rice for the first time in decades 2 weeks ago because I was trying to practice. I chewed it. I was like, this is different. And I actually got fuller sooner. I'm telling you,
yep,
it's a beauty. Chew.
exactly. So when you chew slower, you get fuller sooner because now your body is actually registering that you're actually eating instead of just downing it all at once, and then you don't overeat. So there are things, things like that. I think, try to pick a meal that you eat when you do that you can incorporate a lot of healthy stuff into, and then drink as much water as you can, especially before eating, and then try and chew slower. And just by doing those things, you can start to improve on how you on eating in general and go from there.
Awesome, awesome. I'm going to emphasize a little bit on the chewing slower. So one of the things, because what you're trying to do when you do that is you're trying to tell your brain, I am rewarding you for doing such a good job today. This is good. And you're giving the brain time to talk to the stomach like, we're good. We're really good. So smell the food. Start there. Smell the food, chew it, taste it, the textures, the flavors, the spices. You actually enjoy it more, and you get fuller sooner. So I want to encourage someone who's watching, please try it. It's worth it, okay, for you too. All right, Doc, next question. Hiccups, right? For everything, every good thing, well, I would say most good things, there's usually a challenge about doing it, right? So I have the number one hiccup. I call it meal prepping is hard. Like for
Mm.
someone who would say, like, Doc, I'm glad all this is good, get healthy, make salad. I'm glad you can do all that, but I don't have the time. And meal prepping is just onerous. It looks like a daunting task. Like, what would you say to that person who's watching?
So I actually like meal prepping. I mean, I think so because to me, the alternative is harder. That's how I think about it,
Hmm.
right? I mean, if you're trying to eat and you're really hungry, what you're going to do is you're going to go for the unhealthy options, or you're going to order out a lot, which is hard on the pocket, right? Right.
Oh,
So
yes.
I think like for meal prepping, once you do the work up front as much as you can, then it makes the rest of the week for us anyway, it makes it a lot easier. Now you're just warming up stuff or you're just putting things together. And so it does help. But even if, some people just can't do it because they are on the road a lot, for example, so it's a little
Right.
bit harder. And so for people like that, just focus on what you can add again, like I said, like just do those things as best as you can, choose good options, even if you are going to order out, maybe separate out the sauces and things like that and get more of the greens. Just do your best to incorporate as many healthy options as you possibly can. And I think that will get, because some people also can't cook, so you can learn over time, but in the meantime just start with incorporating as many healthy options as possible.
I love that. I love that. Incorporate as many healthy options as possible. And for those of you who wonder what's meal prepping, it's almost like batch prepping or preparing for meals for the week. So it's easier and easily accessible. So a bag of baby carrots, little things you can grab and little raisin thingy that you can take with you. That's easy access. So that it's not so hard, or you don't have to overthink what you're going to eat that day or for the rest of the week. All right, the next hiccup, Doc, and I get this a lot. It's called the bird food.
Mm.
Sorry. Where patients are like, Doc, that's for the birds. You're essentially telling me to eat food that does not taste good, Doc. What would you say to that? If
Yeah,
someone's
no, it's funny when you said that. Like, my son was like, "Salad? I don't want to eat grass." Like, so it's 5, but but Yeah, the truth is I can't argue with that because there's a saying, one man's meat is another man's poison, right? What
Mm,
tastes good to somebody may not taste good to the other person. But I think the truth is the more you eat healthy, you tend to get used to it usually, and things start to taste better for most people. It does, and then you can make it taste better these days. There are so many creative ways of cooking that you can get into, and things will taste actually pretty good. And when I talk to patients about this, right, many of them actually have a few things. We can always find a few things that they
mm,
like.
mm,
It doesn't have to be things you don't like. So, I just go through all the greens, like, okay, do you like broccoli? Oh, no, I can't stand broccoli. Oh, but I actually like spinach, but I actually like kale. You find the ones you like and you incorporate that as much as possible. So I think what people just lump all of them together and say, I don't like this. But if you take the time to really think about it and say, what do I actually like that I enjoy eating? Oftentimes you will find a few things that you like in the category of fruits and vegetables that you can incorporate, or even nuts and seeds. And some of the seeds actually taste less. So it doesn't matter. You just put it on your salad. You don't even taste it. And it's still good for you, right? So it doesn't hurt. So I think it definitely helps to take that time, find
mm.
out some of those things that you actually like and incorporate them in as many places in your meals as possible. And some of that does take planning, but if you have it in the house, then you're much more likely to eat it. So that's kind of my approach with that.
Awesome, awesome, awesome. Part of enjoying life is trying new things. Like
Right.
you might pleasantly surprise yourself. I'm going to tell you what I did yesterday. So brown rice. My daughter has been asking me to make her food, like lunch for school. She wants mom to make, and I said okay. So yesterday, I made brown rice with quinoa. But I put stew. I
Mm-hmm.
was stew, and I
Yeah.
put chicken, and I mixed it, and I was a little nervous. And so when she got back home, hi mama, how are you? How was lunch? She's like, Mom, that was so good.
Wow.
It was really good. And my son, who's like the one who's like texture, he was eating like the leftover, and I was like, oh my goodness. So combine the things you like with the things you think you wouldn't like. You might be so brown rice and stew with quinoa. And
Yeah.
she showed me the empty. So I'm like, score. So it's amazing once we open our minds to the idea that I want to eat healthy, I want it to taste good, and we start to mix and, like you said, add. It makes for better health outcomes for us, and it's what we eat is a big part of how we live long term. So, thank you so much for the encouragement, Doc. Last words of wisdom. 3 words. If you say 3 things summarily, for our viewers who are watching, who are like, man, I know I need to change. This is hard. What are 3 things you would say to them?
Yeah,
Based
I'll
on
say baby steps. Baby
baby
steps.
steps.
Don't be overwhelmed. Just pick one thing from this and just start doing it. So baby steps number one, and then you'll be surprised down the road how much it makes a difference. And then number two, I'll just say, start to explore, like you mentioned. Try to explore things, taste things here and there, look up stuff, buy something that looks interesting at the grocery store and taste it. You know, and then go from there. And then I'll just say, prioritize your health. Health is too important to delay. You don't want to, look back and regret it later. Just do your best and don't take it for granted right now. Even if you feel healthy, that's not the same as being healthy. You got to check. So prioritize your health.
Awesome, Doc. Thank you so much. And we have quite a few viewers. We have Dr. Sarah. Thank you for joining. Dr. Carola and Dr. Una joined earlier. So thank you all for
Oh,
watching. Now, that being said, there are people who are watching like, she's in Sugarland, Texas. I'm not too far. I have family members who are there. For those who are watching who are like, Doc, where can people connect with you, and how can people connect with you, either as a speaker or to actually work with you one-on-one as a patient? Where can people find you, Doc?
absolutely. So they can go to our website, which is www.intouchprimarycare.com, or you can follow me on Facebook at InTouch Primary, or on Instagram at InTouch Primary, and our InTouch Primary Care YouTube channel. So those are our handles.
Awesome, awesome. And after the live, someone will put those in the comments so people have access to it. But thank you so much for coming. This has been fun and enlightening. I really appreciate you for coming. Thanks, Doc.
Thank you. Thank you for having me.
All right, it's a wrap. Thank you all for watching. Remember, sharing is caring, so please share this with as many people as you know will find this useful. And if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician here in the Mansfield, Texas, and surrounding areas, I am she. Have a good one. All right.